Yes, sir, you can start now.
So very good evening to the respected faculty and our viewers. Myself, Dr. Sachin Chaudhary from Medical Affairs Team Zydus would like to welcome you all for today's event. As you all know, today is a very special day. So let me take an opportunity and wish all of you a very happy sexual and reproductive health awareness day. Now at Zydus, we always put a constant effort to improve the male sexual health. So to continue our journey, today we brings to you yet another exciting event in collaboration with Foxy. Here, the experts in the field going to be discussed upon one of the important topic which is related to male sexual health, and we will try to resolve all your doubts. So without wasting much of your time, let's understand desire. So first of all, I would like to welcome the moderator for today's session. So we have with us a very experienced, energetic, and gold medalist, Dr. Apura Kumar Datta sir with us from Dhanbad. He is a national coordinator for Fox's CMEs and workshops. He has been the in charge of the committee of public awareness. He's also been the faculty of various national and international conferences. He has been published many papers, and throughout his journey, he receives many awards. Just like I'll just enumerate few of them, like Dr. Kamini Rao Yuva Award, then Fox's Young Turk Award. Thank you so much, sir, for accepting our invitations. Along with him, we have another very young and dynamic obstetrician and gynecologist with her, Dr. Muhammad Shama Sultana with us. She has done a PG diploma in ART from Germany. She's she's a chairman and co-founder of Hopin Hospital, Kothapet, Guntur, which is in Andhra Pradesh, and she worked as an infertility consultant at Hopin Hospital. Thank you so much, doctor. Once again, I welcome both of you. With that, now it's time to take the things ahead. So I request Dr. Apura Kumar sir and Dr. Shama Sultana ma'am to take the things ahead. Thank you so much.
Thank you.
Thank you so much.
Thank you.
Dr. Sachin.
Thank you for the warm welcome. So, hello and good evening, and I'm Dr. Shama Sultana, and I welcome all of you to this webinar of Foxy Sexual Medicine Committee and Public Awareness Committee. So today we are here with the Dr. Parag Patil Memorial Public Awareness Live CME question answer session on Let's Understand Desire. Today, on the occasion of Sexual and Reproductive Health Awareness Day, we are here to celebrate and to raise awareness about sexual and reproductive health issues and improve sexual and reproductive health intervention, which shall incorporate sexual pleasure in consideration and improvement. And where we talk about sexual pleasure, we can't miss a term libido, that is sexual desire. Libido sexual desire is typically used to refer to one's overall sexual drive or the degree to which someone has interest in and desire for sex. It's probably best to think of libido as a psychological phenomenon, meaning it is affected by a mix of biological, psychological, and social environmental factors. We are very obliged to have eminent speaker, Professor Dr. G. Venkatramana sir, who shall clarify our queries about sexual desire. I welcome you, sir. And I welcome our chief guest, Dr. Alka Kriplani ma'am, past President Foxy, and I welcome guest of honor, Dr. Basam Mukherjee, Vice President Foxy, and I welcome Neeraj sir and my co-moderator, Apurva Datta. So without any delay, we shall start our session with Foxy theme video. Please play Foxy theme video.
Dear friends, Foxians and women of my country, I am Dr. Shanta Kumari, President of the Federation of Obstetrics and Gynecological Societies of India. As a little girl, I told myself that I have to become something to make a difference. I always believed that if I desired something wholeheartedly, there is a positive force which makes it happen. And here I am, friends, standing in front of you as the 60th President of Foxy, the 38,000 strong committed body of OB-GYNs taking care of women's health in our country. As a young girl, I realized that women play a key role in this world, just like Mother Nature or Stree Shakti as we revere it. It is a guiding force behind all forms of God's creation. And it's only a woman who can actually create a new life.
Hi, I'm Kareena Kapoor Khan and I'm so happy to be here with you, if only on video. Pregnancy is a beautiful experience and I have loved having my babies. I congratulate Dr. Shanta Kumari as taking over on the 60th president of this eminent organization.
Stree Shakti is the embodiment of 5 elements: the sky, the air, the water, the earth, and the fire. Any imbalance in any of these 5 elements creates chaos and calamities. Similarly, when a woman's health is neglected, it disrupts the universal equilibrium. The intimate link between environment and human well-being is very well known. With increasing awareness of the need for clean water, pollution-free air, and pesticide-free food.
Hi, I'm PV Sindhu. Well, it's such a beautiful feeling for me to be an empowered girl, to be a girl in a nurtured and a safe environment.
Protecting health by preserving nature and its ecosystem is easier than curing any disease. So we have taken up the concept of minimizing the female morbidity and mortality and fetal effects by mitigating the adverse impact of environment. My theme this year goes beyond Foxy's commitment towards women's healthcare. Foxy for all, always.
Foxy for All is another inspiring campaign. What you do in this organization.
Okay, so I welcome you all, my dear friends and colleagues. Whenever we are talking about sex and sexuality, it's always considered as a taboo in our society, not among only the general public or people, but even also we as a medico and as a doctor as a whole. We are very least known about the various sex problem, how to deal with various sexual questions, and the same with the treatment of sexual disorders and dysfunction. So to bring this up and to give knowledge of basic sexual treatment, sexuality, and to give the knowledge about the sex education to the general public, this program is initiated by none other than the chairperson of our vibrant dynamic committee, Dr. Neeraj Jadhav, sir. Sir is not, he doesn't need any introduction. Sir is the past president, past secretary of the Rajkot OBG Society. At present, he is the vice president of the Rajkot Menopause Society and the chairperson of our vibrant committee, that is the Foxy Sexual Medicine Committee. I welcome you, sir, for bringing this beautiful program and giving us awareness about the various sexual topic. Over to you, Neeraj sir, to have a brief introduction of this, what about all this program is.
Thank you, Apurva. Good evening and welcome on behalf of Sexual Medicine Committee and Public Awareness Committee of Foxy, which is run by Dr. Kalyan Barmade, a very good friend of mine. We started this public awareness program in memory of our dear friend, late Dr. Parag Patil, who unfortunately we lost him in COVID. Aim was simple: to spread the awareness about the sexual health. We are doing in association with the Zydus Proteja this series since last 2 years. We choose one topic on sexual health and our expert answer all your queries on that topic so that all your questions can be found out, can be solved. Still, there is a lot of stigma when it comes to sexual health and sexual problems. It's surprising that in this era of so many communication tools available, still there is a lot of myths about the sexual health, and we are not that much ready to talk about the sexual health. So it's very important that correct and scientific information reach to the people, and that is our main aim behind this series. And fortunately, today is the 12th February, which is Sexual and Reproductive Health Awareness Day. Sexual health is a broad area that encompass many interrelated challenges and problems. Issues and concerns are human rights related to sexual health, sexual pleasure, eroticism, and sexual satisfaction, diseases like HIV, AIDS, and sexually transmitted infections, violence, female genital mutilation, sexual dysfunctions, and mental health related to sexual health. So today we are going to discuss more about the one topic, that is sexual desire. So let's understand more about it from our expert. We have received few questions in our mail, which will be answered by them. And you can also ask any question related to this topic live also. Don't hesitate, just shoot out the question and our expert will answer them. But it should be related to this topic only, not anything else. So happy learning to everyone, and thanks again for joining this program. Thank you. Thank you. Over to you, Apurva.
Thank you so much, sir. So I will invite Dr. Sama to introduce none other than but the chief guest for today, our very own and dear Dr. Alka ma'am. Yeah. Dr. Sama.
Yes, thank you. So, welcome, ma'am. Dr. Alka Kriplani, ma'am, Director and Head, Department of Gynops and ART at Paras Hospitals, Gurgaon. And she is ex-professor and Head of Department of Obs-Gyn, All India Medical Sciences, New Delhi, India. She is a past president for Foxy 2K16, and she was president for other prominent societies of Obs-Gyn. She is a Padma Shri Awardee 2K15, and she was a FIGO Award Female Obs-Gyn 2021, and she had numerous lectures given 906 and oration 72, live workshops 156, and scientific publications 405, and workshops 130. She has a tremendous interest in gynecological endoscopy, reproductive endocrinology, and high-risk pregnancy. I welcome you, ma'am, and please give your valuable words, ma'am.
Thank you so much for your kind words, dear girl, Shama. From where to start? I'm very, very happy that I'm invited in a little different program. You know, sex is the basis of life. But majority of societies all over the world, there is lot of taboo and myths surrounding the sex. Even we gynecologists are not so comfortable discussing it. Believe me, there are still patients are not comfortable. They think it is a kind of sin to enjoy sex, and so many issues are there. So I really appreciate Neeraj. I would like to say something about Neeraj. Neeraj I came across when I was campaigning for my presidentship. And when I became president, it was only Neeraj Yadav, because of whom I visited Rajkot twice. The kind of leadership he had, the way they treated us, the way he organized conferences, it was a one-man show kind of, whole Rajkot event was, I would like to give the credit to Neeraj. So efficient. He was playing with his daughter at that time. She was just adolescent. So I was highly impressed, Neeraj, with your communicating skills, your depth or understanding of the subject, and see how it is leading you. You are now an established leader, and I really wish you all the best. And I congratulate you for bringing such an important topic on the forefront without hesitation. And I think delegates will be highly benefited, and we need to have more such programs to break this, barrier, the unspoken problem. Sex is so important. It is the center of so many things in life, and we neglect it. So especially our society is very, very conservative. And then Dr. Apurva, again, a very bright young boy. So I wish you people success, and please carry on with this topic, because I think Ajay Mane and these people started from that area and still they are working on it. And we really need to impart education and awareness to our gynae friends. Why only gynae friends? We want to help our patients to, go deep into this subject and help patients. I wish you grand success for this event. Thank you. Thank you for the invitation.
Thank you, madam.
Thank you, ma'am. I would request Apurva sir to introduce our guest of honor, Basa Mukherjee sir.
Thank you so much. Before that, what I'm just telling one line for Alka ma'am, what was not there in the CV. She was such a busy and at that position, but you called once at 12 o'clock in the midnight. Ma'am is always there over phone, bol. And she's a teacher upon teacher and asks anything, and she's like encyclopedia. Now you ask anything, any topic related to OB-GYN, apart from not only endoscopy, anything, and she is always there. Thank you so much, ma'am. And I think at the presidency's time, I was not ever, I was know ki yes, Alka ma'am is there. I sent ma'am a friend request in Facebook in my residency before being she's a president, I think 2015, and she accepted that. And I was like, my goodness, एक resident को जो अभी OB-GYN हुआ भी नहीं है, and she is like accepting that and such a down to earth. Thank you so much, ma'am. So always being there for everyone. Thank you. Thank you, ma'am. So the guest of honor for today is none other than but very dynamic from East and a elder brother for me, very talented Basa Mukherjee sir. Sir is at present the Vice President Foxy. He is the FIGO Regional Coordinator of the Safe Abortion, Secretary IRC India East, Vice President Bengal OB Society, Vice President Kolkata Menopause Society, Secretary IAG Bengal chapter, and what not. A lot of credits toward him, a lot of awards and achievement towards him. We all know him. Thank you so much, sir, for always being there, always blessing us. Over to you, Basab sir, for your kind words and your blessings.
Thank you, Apurva. It's a pleasant task to be here on Neeraj's request. Neeraj is doing wonderful work in the Sexual Medicine Committee, and I think everybody can see the wonderful work that he and the committee members are doing. Dr. Sharma, Dr. Apurva, and the other committee members there. Everybody is contributing massively. I have just 2 points to say. I think one thing which you must consider in Neeraj's year, because they're doing so much of activity, is a certificate course on sexual medicine. I think that is of immense benefit to a lot of people who are actually interested, either through FOGSI or through ICOG or through some form. We have to have a certificate course on sexual medicine, because that will give the interested people, who a lot of people are, but that a lot of people may not be able to attend all the wonderful webinars which you are doing, but they will be attending these courses because they want to have some, very much as Dr. Alka said, they want to have the facts which they need for or the skills that they need for patients when they come in front of us dealing with sexual problems. So a certificate course is something, Neeraj, which you must start before you finish your term. That's number one. Number two, I think, is publications. I think I've told Neeraj once that the wonderful work that you're doing, so one day desire, one day erection, one day ejaculation, one day orgasm. So I think the wonderful work that you're doing should be put into some paper, it should be printed, it should be published. So it's not something like a FAQ form, not very big, not something which is very big. You may have a couple of things like a clinical cases sort of a thing. That's something different that can come in your case series, that can come in your newsletter, but something you should have like an FAQs on different things of sexual dysfunction or FSD and male sexual dysfunction, and put it up, and you publish it from your committee. So I think if Zaidas Fortiza has doing so well, with you. They will be bearing the cost of the publication, and I'm sure they'll be very happy to spread this across to a lot of clinicians all over the country, because everybody cannot attend the webinar. A lot of people have understand that this is really wonderful information and they need the information. It's not that like as Dr. Alka said, nobody really knows this sexual health as much as they need to know. So gynecologists, a lot of times we are the one-stop person, will come with some problem and we will try to give her something or the other, and we are not very sure ourselves. So I think it's so important, these two things. One is some publications from your point, so that we get the message across to a wider audience, again through the pharmaceutical partners, because they will be spreading it to all the people they visit and they reach out to. That is one. And the second is a certificate course. You do it 3 days, do it a week, do it something, but there's something which definitely you need to equip a lot of Foxians and maybe other doctors who they're interested in the long run to some such sexual health program, because there are no sexologists in our country. So that is the thing, because once a sexologist seems to be a bad word now, and at the same time a gynecologist is a sexologist, an andrologist is a sexologist, a urologist is a sexologist, general medicine is a sexologist. It's very confusing for everybody. So I think instead of doing a book, instead of doing something else, I think this is something which will reach out and which will have a lot of takers, and the immense benefit will be reaching out to a lot of people. So congratulations, Neeraj, on the good work that you're already doing with your committee members. I wish you all the best, and we look forward to working together throughout this year. Thank you.
We already have a publications for our gynec friend and for general public also, with the support of Zydus Proteja. We have at least, I think, 8 publications till now for public awareness, and 8 to 9 for our gynec friend we have published till date. And yes, and your suggestion about certificate course, yes, we will do that. Definitely, we are interested in the certificate course.
Because you have so much of active members in your committee now. Your committee is full of active members. They're really all bubbling with energy and enthusiasm. This has to be done because all of you guys are very, very effective and very efficient together.
Thank you. Thank you.
Hello. Thank you.
Thank you. Thank you so much, sir, for your blessings and your kind words, sir. So, Amma, you introduce our
Yes. I would like to introduce today's our faculty eminent speaker, our Dr. G. Venkataramana sir. He is a senior consultant sexologist, dermatologist, and HIV/AIDS specialist. And he is president of Indian Anthropo Society, vice president CSEPI, WHO Fellow 1990 and 2009. He is a Golden Lamp Awardee, highest honor in the field of Indian sexology, and also Best Sexologist Award 2005 by Virodi Foundation, working for bringing awareness in STD, HIV, and sex education. Welcome you, sir, and please take over. Want to hear from you a lot today. Thank you, sir.
Sir. Hello, Venkatesh sir.
Good evening, all.
Yeah.
Am I audible to you all?
Yes, sir.
Yes, sir.
You're audible, sir.
Good evening to you all, and warm greetings from Hyderabad. At the outset, let me thank our Neeraj Jadhav Saab and all the committee members of the Sexual Health Committee of Foxy and all the people involved in this wonderful program. I thank you very much. At the same time, I congratulate you all for taking up this important topic. Because of not understanding the proper sex, what is scientific sex, many all unscientific things are happening in the community. And we have taken the bad reputation that India is the rape capital of the world. So right time, you have taken the right decision of educating the mass. That's a very noble cause you have taken up, Neeraj sir. I once again congratulate on behalf of our CSCPI. We run a large organization called Council of Sex Education Parenthood International. This is the first and foremost body in India. And our later Dr. Parag Patil is our product. Of course, he is from Foxy and undoubtedly, but he is our product too.
Thank you, sir.
Thank you, sir. Thank you very much.
Build your laptop. You your whole face is not visible, sir. You can tilt your laptop little bit. Right. Perfect now.
Right.
Yes.
So now, thank you so much, sir, for taking our invitation and to be a part of this program as a faculty and giving your expert views for that. So today, the topic for today's discussion, which is directed to the general public, is let's understand what is desire. Sir, what you have correctly said, that whatever, when we are talking as an adolescent, when we are facing that, when we are talking about and we have heard about these things like what is sex and what is desire, what is this, what is that, so we are very confused, and
Yes,
the
yes.
main thing is at that time what we are getting, the information from our peers, and which are the equally good than us. And secondly, we are searching in the internet, and it also causes lots and lots of unfiltered and misinformation, misguidance. So to bring out those important things and important topic is very important, and that is what we are taking this particular topic. And my particular first question is, sir, what is meaning of desire? What is the meaning of desire? When we are talking about desire, there's a lot of things are coming in our mind. But what for the general public, what you want to say, what is desire?
Okay. Before answering this question, let me introduce the subject to all the audience, particularly keeping in view of general public. In this entire universe, right from unicellular amoeba to highly evolved we thinking animals, we are human beings, nothing but thinking animals. Everybody, amoeba, hydra, rat, guinea pig, monkey, donkey, buffalo, human being, you name anything which is having life, is bestowed with a basic instinct called sexual union. This basic instinct is utilized for procreational purposes only in all the living organisms except we human beings. When all the living organisms are utilizing this basic instinct for procreational purposes, the mating takes place only at the time of ovulation. At the time of ovulation, the females will release the chemicals called pheromones, which will be attracted by the male. Male will go and have a sex and produce daughter monkeys, daughter virions, daughter amoeba, daughter hydra. Whereas we human beings, we are utilizing this for recreational purposes as the priority. Procreation has to take on the second place, or I can say as a byproduct. Of course, in spite of that, we are 140 crore population. That is different issue. When we human beings, we are utilizing it for recreational purposes, always the tendency will be to enjoy more, to get more. That attitude will be there. If Neeraj Yadav Saab offers a cup of coffee to all of us, if the coffee is excellent, then we feel like Neeraj Saab abhi cup chahiye mere ko. When Neeraj Saab gives another cup, immediately Shama Sultana Saab says, Dak Saab, ye kya pita hai mere ghar ko, abhi acha coffee pilayenge. So there is no end for this. So we will be going on experimenting. So when we are usually utilizing for recreational purposes, that experimentation becomes a norm. When we do experimentation, we may suffer with dysfunctions. We will be comparing with that fellow, we'll be comparing with this woman, and we'll feeling that our experimentation, our what you call adventures are very less, are not that much enough to that equating to that person, so we feel that we are dysfunctional. Or our partners may be unhappy, saying that we feel inferior and we feel dysfunctional. Or we may get, because of this sexual experimentation, transfer of sexual infections will occur from here to there to here. Or we may get unwanted pregnancies, which we are not hoping for at all. So as a result of this, a lot of physical and psychological turmoil will occur. So in order to know and in order to bail out from all these problems, lot of research is going on for the last 100 years throughout the globe. And the research came to thrown some light in 1960s and 70s by Dr. Masterson Johnson. William Masterson and Virginia Johnson are the two researchers. They could, after their research, they could come out saying that the sexual response cycle goes like this in the form of desire, plateau, orgasm, and resolution. So now this desire is the beginning of the sexual response cycle in human beings. Nothing but in simply desire is that is generated in the mind, willingness to participate in the sex or willingness towards sex, willingness to meet partners, maybe female or male. So this is a positive willingness, that is emotional behavior, emotional idea that comes in the mind, willing to do sex, willing to do sexual things, showing interest towards sexual objects, is it called desire. Dr. Sigmund Freud, a psychologist and the father of modern psychology, he calls this as a lust, L-U-S-T. This is the one part of libido. Libido is a broad term in which lust is the one part of it that is translates into desire. So in short, desire is an emotional thing, wanting to, willing to do sex and meet the sexual objects. Right, Bayapur?
Very correctly said, sir. Sir, but what actually general consensus is, what you have very correctly told, desire, libido, and people are thinking those all are the same thing. Is it different, or these are the same?
Slight difference is there technically as a medical person. For a common man, all are interchangeably used.
Okay. Thank you so much. So coming to next question, Dr. Sama, over to you.
What causes sexual desire?
Sama, you have to unmute yourself.
Sir, unmute yourself,
Yes.
Dr. Sama.
What causes sexual desire, sir?
Yes. This sexual desire, as I told you, is generated in the mind. Is under the influence of hormones like testosterone and estrogen. This testosterone and estrogen is stimulated and released in the brain because of either fantasy, or because of looks, or because of touch, or because of reading, or because of hearing. Through all these special senses, we get stimulated in the mind, which releases the testosterone and estrogen, predominantly testosterone in the males, predominantly estrogen and a little testosterone in the females, which makes us a titillating effect, showing interest towards sexuality, sexual things. My friends, it is the special senses and hormones that makes the desire.
Sir, when you have correctly said that there may be something, some initial factor is there to have the desire. So I just wanted to know how this sexual desire process starts. Like you have told after reading, or maybe after seeing, or maybe after touching, or maybe after thinking of something, we got that desire. So how this process started?
This process starts in the mind. As I told you, under the influence of these hormones, the person feel like shows some interest towards the sex and willing to participate in the sex, willing to associate with the partner. So in order to do this, hormones, first part of it is started by hormones. Once it starts, it sends the message that comes through the central nervous system to spinal nerves, from there to parasympathetic nerves of S2, 3, 4. We call it as nervus eractx. The message comes to the genitalia. In the male, it produces blood gush into the penis, and penis becomes strong and strong, it becomes erect. When the blood gushes to the female genitalia, she will produce lubrication in the vagina, indicating thus ready for sexual intercourse. That's called a plateau period in the Master Jackson's classification. When this still mounting on, the person, if it is a male, may resort to masturbation as solo sex, or may partner is available, indulge in sexual intercourse. As a result, when it reaches the peak, the male will ejaculate, reaching a pleasurable sensation in the mind called orgasm. Then all the changes that occur right from the desire plateau to orgasm will be reverted back to the normalcy. That's called resolution. This is how the whole process will start. That's called sexual response cycle. For that, the desire is the beginning of the total process. This desire is under hormonal control predominantly. Testosterone is the mostly predominant hormone in the male. Estrogen, to a lesser extent, testosterone do play in females.
I just wanted to ask you, when you are talking about the desire, about the touch, about the seeing, why and what are the causes that call desire of man to man or the female to female when we are talking about the same-sex sexuality? Why? Because in a particular case, and suppose that these touch and these everything cause desire, why the few people has got that erection after seeing man to man, and why not all? And same for the females.
Yes, it's a very deep question, needs a lot of explanation for this. As I told you, we human beings are having basic instinct. Not only human beings, every living organism. This basic instinct is called by our Sigmund Freud as a sexual energy, called libido. This libido is a part of id. The human psychology is explained, the way it works is by id, ego, superego. In your initial video, Foxy theme video has been played, where Madam was telling that Sri Shakti is made of 5 elements. If in that way I can explain that we have certain chakras in the body right from the sacrum to occiput, namely Mooladhara Chakra, Swadhisthana Chakra, Manipuraka Chakra, Anahata, Vishuddha, Agnya, Sahasra. This thing I'm going again to spirituality. I don't want to go spiritual. I want to compare this. When the person is in the id level, that is in the pediatric age group, right from the birth to up to 3 years, at the id level, the libidinous energy is more pleasure oriented. If the child becomes hungry, she cries. Unless the child gets its feeding, goes on crying. When the mother gives the milk, child will become calm. So immediate need is there. It has to be tackled. That is pleasure dependent. Whereas that pleasure dependent desire is controlled by ego, saying that, Are Baba, yes, you are having a desire, appetite, but this is not the right time to ask your food. We are in the lecture now. You are giving a talk to the doctors. You should not ask appetite, give me a cup of coffee. That's only at the end of the lecture you can ask for a cup of coffee. So that information is controlled by ego. That is a process indicated process. So when the person, the infant, when it grows through oral stage, anal stage, genital stage, then latent stage, then sexual stage. So people who are fixed in the oral stage, they didn't develop into the anal stage. They are mostly fixated in the adulthood as the oral sex people are talking more about sex, are talking all rubbish things. When they are fixed in the anal stage, they are more interested towards anal sex. Like that, when their psychosexual development is arrested because of this, they will be more attracted. This is only part. Genetics will play a role. Social, cultural values play a role. Interpersonal values play a role. Apart from this, genetics and psychosexual development. That's why majority in the world are heterosexual. Few people will be attracted to same sex because of arrest somewhere in their psychosexual development.
Sir,
Yeah.
Sir, here I just wanted to ask one more thing, very practical thing.
Mhm.
When I'm seeing this type of patients who are having some sexual dysfunction, the male as well as the female, and when I ask them deeper questions,
Mhm.
there is some amount of sexual harassment in their childhood. So
Yes.
can we say that
Yes,
this
yes.
actually this sexual abuse or harassment in
Absolutely.
that particular stage caused this orientation?
Absolutely. That also plays a major role in their psychosexual development. Suppression, punishments, abuse, rape, all these things will play a role.
Thank you.
So,
Thank you so much.
so a little more deeper, like love. Does love and sexual desire same or different aspects?
Love is a very broad term. Sexual desire is a part of love. Love is a broad term. Sexual desire is a part of love. This love again, initially, it will be a lustful love, where again dominated by the hormones like testosterone and estrogen. Then followed by attractive love. First one is lustful love, that means more physically oriented. If a boy or girls in the young youth group or a newly married bride and bridegroom in their early days of marriage, they are least bothered about her willingness, her problem, what is her mind, what is his mind. They are more towards physics. Just have sex, have sex, have sex. So that is a lustful love. As the time passes on, when they start understanding each other, Then start the attraction, where dominated by the oxytocin, dopamine, other hormones will play into picture. Followed by lustful love over, attraction over, then followed by attachment, where they are very comfortable, they could understand each other well. Even the wife is in America, husband is in India, they are well connected by heart. Whereas in the early days of marriage, early days of coupling, where the lustful love is going on, at that juncture, if separation occurs because of due to different jobs or something, some other reason, then that attachment will be very, very meager. Chances of experimentation, extramarital affairs will start there in that relation. When the couple is having attachment love, they won't do any mistakes. They are committed wherever they are. One is in the South Globe, another is the North Globe, yet they are connected by souls. So that is the deepest part of love.
Sir, so can we say that is the end point of the love is the desire, or it is the sexual, it's or drive or something like that?
Sexual desire, yes, is a part of love.
Okay. Okay. Sir, next question is the same what you have stated. Why the sexual desire is very strong at the beginning of the relationship? Okay,
Yes.
and not at the end. What you have stated, I just want to elaborate, because many a time patient are coming with us and they told कि यार पहले तो बिल्कुल बड़ा अच्छा सा लगता था और हम अभी भी करते हैं, but we don't get that drive which we are getting in the beginning. So sir, what's the actually why this happened? It is the age or something different? Yeah.
So the desire that is strong at the beginning of relationship is when anybody starts a relationship somewhere around 15 years to 25 years. Of late, we are starting relationship, our generation starting relationship, present generation starting relationship somewhere around 20 to 30. Right? When the relationship was started at around 15 years to 25 years age, hormones were peak in levels. So desire is at the peak level. That desire was a lustful desire. So always think of sex, nothing else sex. That's why the desire was strong. This desire is fluctuating in nature. The nature of the desire is not a constant for any time. It's a fluctuating. If I am your patient, when I say that my desire is a very strong, doctor, immediately if I get an income tax notice, my desire runs away into Atlantic Ocean. Now I will develop panicky, anxiety. What will happen? What the income tax fellow is going to do? What is going to happen? So the desire goes to ebb. It fluctuates. Or if I get some corona fever or some typhoid fever, the desire goes down. Or if I use antibiotics or anti-inflammatory agents or some steroids, some other drugs, my desire comes down. If I use antipsychotics, desire comes down. So like this is a fluctuating. If I age, now if I am 40 years, desire will come down. If I am 60, desire will be very at the lower level. Particularly women, more prone for these fluctuations because of the hormonal cycles of menstruation. The desire will be peak at the peri-ovulatory period. Desire will be low at the menstrual period. Like this, it will be fluctuating. As rightly said, desire will be strongest in the initial days of the coupling, initial days of relationship, because of the high levels of hormone, high levels of lustful love will be there in the couples.
So next question, like, yeah, as you correctly said, around the ovulatory phase, women will have a larger sexual drive, and moreover, how completely sexual drive will be different in men and women.
Yes, it is different because if you look anthropologically, man was a hunter in the olden days. His duty is go around the hunt the needy food for the family. Whichever looks good, he has to hunt. So he is more towards looking and picking up whichever is good to him. Whatever looks good to him, he picks up. He is wired in that way, our ancient man. He will bring that to the house. The duty of the wife is cook that food what the man got it, serve to the family members, look after the family, nurture the family with the love and affection. That's why wife becomes the caretaker, home caretaker, family home taker, homemaker. So with that wired lifestyle, man is more towards external. He is always thinking of looks, imagining about looks, reading, listening will make him always sexual. Whenever you say Mr. XYZ, Mr. Venkat, sex hai, chalo sab jayenge. Whereas woman always thinks of intimacy. She's basically a homemaker. She has to look after, nurture the feelings of the family. She will be always thinking, if I go to with Venkat, whether Venkat look after me well, whether Venkat look after my children, whether Venkat can be of that person who takes care of my family. So she will assess. If she feels, yes, this Venkat is going to do justice to me, then she will open up her desire towards sex. That's why man is always looking for a space to have sex. Woman looks for a reason to have a sex. Woman is always more needs emotional attachment. Whereas man just needs a look, good look sufficient, he will be ready. In a common man's language, I will explain you. Istri is like istri. Istri means iron box. If you start iron box, it takes some time to become hot, then only you can press the clothes. Whereas male is like a switch. If you put on the switch, light will glow. So this failure is always instantaneous, like a switch. Once you put on the switch, he'll be ready for sex. Whereas a female is like a istri. It takes some time. That sometime is because of the emotional attachment, what she needs. That's why the sex drive differs from male and female. Apart from this, the hormonal fluctuations in the female will make them peri-ovulatory more desire, because the nature has designed in such a way that time sexual intercourse is needed for fertilization, for reproduction. That's why at the peri-ovulatory period, the desire will be more.
Sir, when the question arises, now why a desire to a particular person? When we are talking about, then we are usually seeing like the previously and even nowadays in the most of the cases we have the monogamous relationship. Why there is only in a particular person there is a desire and not with the any other things? Like is it is due to the social, due to the cultural, or due to some hormonal? What is your thoughts and what's the reason behind it?
Desire is a common, it will be there for everybody. But as I told you, it fluctuates. Some may have low, some may have high. It's controlled by, rather stimulated by the hormones, but it is regulated by the family values, socio-cultural values. It is regulated by, and it is exhibited by the physical capacity, health of the individual. Society is permitting to have sex, hormone is there, but that fellow is having uncontrolled diabetes, he cannot perform, he or she. The body is having multiple joint pains, rheumatoid arthritis, he cannot perform.
Okay.
So desire should be there, socio-cultural grantness should be there. Yes, I'm having good desire, but my society is not permitting it to do in masturbation. Society has inculcating me masturbation is a sin. Then if I am masturbating, I always get, I did a mistake, I did a sin, God will punish me, my dad will punish me, my Dr. Apur will punish me, my Salma Sultana punish me. So I will be always having something in mind. I'll become more psychological.
Correct.
I'll be ending in somewhere else.
Sir, we are a lot of talking about the desire, good on everything. Now the question now is why there is a less desire nowadays. So this is very particular questions, because previously, I don't know, maybe the people are not coming up, but what I am, because I am also practicing the sexual medicine, and even the newly married couple,
Yes.
at a very young age, at the age of like the husband is 34, the wife is 21 or 22, and they are even come with us to have the loss of desire or loss of libido, something like that. So,
Yes.
sir, why did you in your practice also? I think you are getting all those things. What your views that what is the cause of this type of desire, loss of desire? First thing. Secondly, what actually, sir, we are thinking of that these loss of desire maybe there in a metro cities where there's a people are at a very hurry, or very fast life is there. But even in a small villages, even Kaspa and cities, small cities, the 2 tier, 3 tier cities like ours, there's a lot of patients are coming with that. Sir, what's your interpretation of this loss of desire? What is there any chronic disease or acute disease, or is there any age factor which cause this type of loss of desire?
This is a very common even in my practice also. In fact, when Dr. Neeraj Saab has telephoned me 7 minutes before 6 o'clock, doctor, did you join? Then I am struggling with my patients. That the case which I was dealing with, that was only less desire case only. 25 years as software engineer, married to 24 years as software engineer, 1.5 months of married life. Came to me today. I was dealing with that when Dr. Neeraj has telephoned me. Question is, I don't have interest. Why? What is the reason why you don't have interest? I didn't like that girl. Then why you married that girl? Because of family pressures, I married. Then who is at fault now? Whether this boy or the family? This is one today I have seen. Like this, I am seeing for the last 40 years, I am seeing like these cases.
Sir, just to interrupt you, sir. Last week I got a similar type of patient. Husband is 30, wife is 28, and what the husband is saying, I loved her tremendously. She is best suited me. Nobody can take care like what we have. We are in a deep love, but we don't have desire to have a sexual intercourse. So, in that particular case, what your interpretation and what you want to do?
It needs more psychoanalysis of that boy. When he's appreciating the girl so much, why he's not getting desire sexually? Whether he's equating the wife with the mother, whether he's equating the wife with sister, or he is asexual, some reason should be there. So more ticking towards his psychology, his mind is needed to solve that puzzle in that couple. So coming for this effects of age on sexual desire, why the person will have low desires, high desires. This low desires is because of multiple factors will play a role. Upbringing, health status, interpersonal problems, socio-cultural problems will play a role. Of late, as a sexologist, you and me are seeing more cases like this because of the interpersonal problems. Lot of ego problems are coming in between the couples into the relationship. After this IT revolution, the scientific information and unscientific information is at the doorstep. Once the smartphones has come, one way it made easy, life made easy, other way it made life to spoil, to rot. Is it what you call bidirectional sword? It is a sharp on two sides. It can cut either way, but it is cutting on the wrong side. Many people are seeing this and thinking that, see, this fellow penis is, see how much is there, see your penis. See, my friend is telling that they had sex 6 times last night. You fellow, you are unable to do even once. I am earning more than you. You should listen to me. Vice versa. The boy blaming the girl. See the boobs like this. See what you are. Like this, lot of comparisons, ego problems are creeping into the relationship, spoiling the moods and getting low desire towards the partner. Low desire not for everybody. The girl is getting low desire for husband, husband is getting low desire for the wife. Because of the diseases, say diabetic, uncontrolled diabetes, hypertension, antidepressants, or steroid usage, oral contraceptive usage, there the low desire is uniform. It is a global. Whereas ego problems, interpersonal problems is a situational. All the sexual problems has to be viewed, should view as a global or situational. So some global problems always we have to think of is systemic problems, whether any diseases, uncontrolled diseases, or the drugs which he is taking are the culprits. When it is a situational, we have to think more interpersonal and intrapersonal, psychological.
When you were saying about means he may be comparing with mother or sister, one of my couple who came like the lady who had PCOS complaints after last childbirth of 5 years. She has also complained of unhappy sexual life. When I was digging into their life, means I was counseling the couple. Then separately, when I asked husband, he was telling, now I have love and care towards my wife, but it is like I love my kids. I also care my wife, but I don't have a sexual desire towards her. Finally, I land up with less sexual desire when she wants. So
Yes.
that was a complaint.
The problem here is he is sharing more love and affection towards the children. So he is unable to concentrate and give due attention to the wife. When he is unable to give due attention to the wife, natural, usual way, the wife will grunt, will become little bit angry, annoying. That angry, annoying behavior will will make the distance more between the couple. That fellow will again go away from the wife regarding sexual matters. Some intelligent wife, some couple, they themselves will solve their problems. That intelligent wife, she will keep quiet and she will coolly, calmly ask the husband, Any problem? Anything, any changes from my side is needed? Why we lost that spark, what we had before pregnancy? You tell me whatever changes you want from my side, I'm ready to get changed. Or what else can I do to get back that spark in you? That way they will solve their problems. Those people who are unable to solve, they will be fighting. That fighting will make the distance more between the wife and husband.
Yes.
Sir, many time we are getting like patient of sudden loss of libido or sudden loss of desire, especially in many time like newly married couple or some even in a aged or who are having previous happy sexual life, but they are complaining of sudden loss of libido. So what may be the actual cause? This is related with some hormones or it is related with some ages, some chronic disease. What is maybe the causes of that and how to treat that?
Sudden loss is not because of the hormones. Hormones will be always a gradual loss. Unless there is a surgery, endocrine surgery, where sudden cutoff is there. Otherwise, hormone loss will be a gradual in nature. When a person is getting sudden loss of libido means acute stress, psychological trauma, very what you call strong interpersonal conflict between the partners, sudden loss of job, financial crisis, severe illness. Suddenly that fellow is diagnosed as HIV positive or cancer positive. So that will be a blow for his, and he is always thinking how many days I am going to live. So he'll be preparing how much I have to store, how much I have to give my children. My children are still 10 years, 12 years. I may not see their future. So his libido becomes zero. He is in planning and preparing himself for death. So such acute illness. So these type of problems, reasons will make the fellow to lose libido suddenly, desire suddenly. Gradual loss of libido is age, for example, menopause, andropause in males, simple age, prolonged usage of anti-hormonal drugs, oral contraceptive pills, cypriodine acetate, steroids, antidepressants, antihypertensives, anti-diabetics. And one more, yes, pertinently you have brought up this topic. Today, we are all, including me and you, we are all in the era of plasticity. We are utilizing, consuming the plastics like anything, which are all anti-hormonal, anti-androgens. Plastic bottles, perfumes, body sprays, room sprays, food preservatives. The vegetables we are purchasing, the fruits which are purchasing, all filled with fertilizers, which are xenoestrogens, proestrogens. So prolonged usage of these will bring down the desire level, and fertility level is coming down, desire level is coming down, performance level is coming down. That's why today, when I was a medical student way back in 1970s, the semen analysis, the fertility count was 50 millions. When I became assistant professor, WHO has reduced the fertility count of semen analysis for 35 millions. Today it has reduced to 15 to 20 millions. So why this is happening is because of our lifestyles. Leave alone the hormones, leave alone the things. Our lifestyle has become like that. We are utilizing more anti-androgens, more plastics, more preservatives, more chemicals. So also those things will reduce the libido.
Okay, so Does non-consummated marriages means a lack of sexual desire?
Only one aspect of it. Non-consummation of marriage, again multifactorial. It can be from the male side, from the female side, from the both the sides. It can be from male side, whether it is physical or psychological. If it is a physical, erectile dysfunction is the reason. If it is a psychological, low libido or interpersonal problems, आप मेरे को अच्छा सूट देते बोले शादी में तो नहीं दिया, देखो अब क्या करेंगे मैं, राइट? नहीं तो आपका अम्मी मेरे को गालियां दिया शादी में, देखो अब मैं सताता हूं तुम्हारे. So this is interpersonal revenge attitude. Or that fellow is an antidepressant, married because of the want to marry and because of family pressure. He won't get mood. He won't get desire. So this is male side. If it comes to female side, this girl is reared in such a way, देखो बेटी, सेक्स मत करना, ये गलत है, पाप है, कोई भी टच नहीं करना. With that attitude, the girl was grown, and now suddenly, बेटी तुम्हारा मैं शादी है आज तुम्हारा शादी, कल first night है. So how that Beti, who was reared all these 22 years saying that sex is a sinful, nobody should touch there, nobody should talk about it. Suddenly the husband comes with the erect penis. What will be the fate of her? She will scream at it and develop vaginismus. Right? Or the girl is having already know about it, had sexual intercourse prior to marriage, developed herpes, developed candle vaginitis, having infection. When this fellow starts in the marriage, first time going to have sex, gets pain. She screams about it. Chalo, chalo, nako, nako, mere dard aa raha hai. So like this, multiple factors are there. So each case is a unique. We have to evaluate. There won't be a common reason for all the unconsummated marriages. Each couple will have their own reasons, and it is we who have to evaluate and give treatment accordingly. Help them accordingly.
I think this is already discussed, Dr. Sama. So we can have the next question.
Yes.
Sir, just I wanted to ask you.
Okay, we can discuss this. No problem. This is good question. Okay. You have put a good question.
Okay. Sir,
sexual desire is spontaneous or responsive, like don't feel turning until the things get on. Yes, sexual desire is of 3 types. Namely, as rightly pointed out, spontaneous one. Second one is responsive. Third one is mixed one. Spontaneous desire means getting at an instinct, getting attracted towards others. Feel like having sex, feel like having touching her, feel like having meeting her. That's the instant. It happens just like that. This type of spontaneous desire is more common in males. I can put it as 70 to 75% of males will have spontaneous desire, whereas 15 to 20% of females will have spontaneous desire. Females are more wired for responsive desire. As I explained earlier, female is like a istri, takes some time. She develops, she needs intimacy. She needs pampering of her desires. That's why whenever there is a response, whenever the husband or a boyfriend who pampers her, who consoles her, who gives warmthness to her, when she is comfortable, then as a response to that, she gets ready for sexual desire. That is responsive desire. That is more common in females. And via media, both the things will be there in the majority of the couples called a mixed type desire.
Okay, sir. Sir, so many time we are hearing that we have a very true or very high sexual desire. So is true to say that yes, this person has very high desire or this person has very low desire?
Is
Or
again
is the
and
same for what I am, but I many a time even we are patient are coming with us and they are saying that, oh, I have less desire. And testosterone level, and even the testosterone level is normal. They are asking us, give us some testosterone supplement so that we can have more or the high sexual desire. It is a correct term.
before going to the proper answer, long back in my early days of practice, one senior gentleman came, somewhere around 55 years of age man, came and said to me, Doc, I have high sexual desire. Can you kindly lower it? And I didn't get what he means. Everybody will come to me for high desire, but you are the only person coming to me, first person coming to me to lower the desire. I am very happy and I am at the same time perplexed to see this. I have to search the literature to how to reduce the desire. No, doc, you are not understanding. My desire is very high in the brain only. Kindly lower it to the penis. So that fellow wants in a different way. My friends, desire till now, even after 100 years of research, before 100 years, many rishis, scholars, many people have defined it. Lot of manuals are there in the world. Centuries back, 6,000 years back, Vastayana Kama Sutra is there in India. Perfume Garden is there, written by our Islamic poets in the European, Arabian countries. Lot of books are available in Egypt. Lot of books are available in China describing the sexual manuals. But nobody is able to give what is the normal desire. Even today, nothing like a normal desire. Yet we are defining it as a normal desire pertaining to that couple. For example, a patient, a husband and wife are before you. Wife says, any husband should at least do 5 to 6 times sex a day. Then only he'll be called as a man. This fellow does only twice. He's not a fit. Can we label him as a hypogonadal, or can we label as a less desire fellow? Or vice versa, husband claims that wife is not all willing, sir, always says only one time a day you have to do. Rest of the times, no, I won't allow you. Does we blame that wife has a hypo desire? Absolutely not. It's all because of their education, information, what is pumped into their minds. Why that this girl developed the feeling of doing 6 times a day is only a human, only a man, less than 6 times is not a man. So she got a wrong idea into the mind. She needs sex education. Why this fellow is more after the sex, and why when the wife is allowing it only one time. So all this is information based knowledge is going wrong. We say based on that couple's knowledge, couple's need, if the problem is troubling them, either because of desire level low is troubling the couple relationship, desire level is high troubling the couple relationship, then we are putting a definition of low desire and high desire. For example, doctor, this fellow is a nice fellow. We are married for last 9 months. He looks after me very well. But the only thing is, this fellow is always after sex. He won't allow me to cook. He won't allow me to keep the house neat. He will be always after this. I won't say that he is a bad fellow. He is a nice fellow. But if we change a little bit this, so that I can cook, I can cook nice food for that fellow. So the more desire of the husband is troubling the relationship. There we have to be addressed. Another example, doctor, this fellow does 5 to 6 times sex. Is it okay? Is it normal? My friend told me that her husband does only twice a day. Whether are we overdoing it? As long as this wife and husband are comfortable with 5 to 6 times, this is normal for them. As long as that wife and husband who are having only twice a day, when they are comfortable, that is normal for them. So nothing like a universal normal. It is a couple based, that is case to case based. So we have to decide whether it is hypo or hyper is based on the case to case.
So one of my
Dr. Sama, please.
Actually, as you said, so means some couple coming and telling that other partner is having a higher sexual desire. One of my couples, one lady, she had means she's 3 years of marriage, and she went to her mother's place for 1.5 years, and again she came back to her husband, and now she came back she came to my OPD saying, please tell my husband that I have some vaginal infection and I have pain. So I asked her, why you want me to say like that? You have a very healthy vagina and no problem in the cervix as well. Also, she's telling her he is asking for the sex a lot of times, which I'm not feeling comfortable. So I asked her, you don't want kids or what? For kids, I want to have sex. I want to plan it, but not like this. This many times I don't want in a day. Please tell him that these many times will spoil my vagina, or it will aggravate my pain. You tell him like that, Polke, she was saying. I counsel that couple, but what if one partner's sexual desire is higher than the other or lower than the other? What are the circumstances they can face?
This type, we got many. One extreme of this type is few years back I had, where the wife's brothers, they have beaten this husband. You fellow, you are doing 5 to 6 times to my sister. What will be the health of my sister? You have to do only once a day. If my sister complains here afterwards that he is doing more than twice and thrice, will beat you like this again. So that fellow came with weeping. Sir, my brother-in-laws are beating me if I go for my wife to do sex. So such extremes are there in the community. So this all depends upon how this boy is brought up, what is his view on the sexuality, how the girl is brought up, what is her view on the sexuality. As I told you, sexual appetite or sexual desire differs from person to person. That desire differs from morning to evening. So many parameters will play a role. So when there is a desire discrepancy between the wife and husband, such problems will arise. This desire discrepancy has to be counseled and sex therapy in a way via media to solve both the ends to meet. For example, the same story, a couple whom you depicted, wife is not willing and she feels that she's having that idea that sex is a negative, sex is not a good thing, it spoils the vagina, it spoils the body. So for her needs education, the sex is having lot of benefits. It gives you pleasure. It boosts your self-confidence. It gives you, raises your immunity. It brings you glow in your skin and face. It takes off your dysmenoric pains, and it gives you child also all the more. At the same time, when you are getting orgasm in the sex, your pelvic muscles will become strong so that you won't get prolapses of uterine prolapse, cervical prolapse, urethral prolapse, vaginal prolapse in future. So when you enumerate, she may change or may not change. If may change, yes, you have succeeded in doing that. If may not change, then we have to educate the husband. Baba, you can desire, you can get same pleasure what you want with your desire. Just cajole her, massage her, kiss her, so that you can get your solace, your enjoyment, so that she won't be keep you away. You will be saving your relationship. Like that, as a sex therapist, it is our duty to find out a solution. At the same time, we have to evaluate for any health reasons, any what you call causes, hormonal disturbances, any drugs, iatrogenic causes, those things has to be addressed. At the same time, as I told you, my case where the brother-in-laws are beating, so family interferences is another reason why the relationships are spoiled. So counseling the families also becomes important in certain cases. Their interference has to be as least as possible to save the relationship. So all these things has to be addressed for the needy couples. It's all again case by case based.
Sir, we are talking about a lot of, this loss of sexual desire, loss of increasing the sexual desire. So many times people are coming and they are asking, is there any method or is there any food or is there any exercise or any pelvic exercise or anything which are non-pharmacological to increase the sexual desire or libido? Non-pharmacological.
Yes, excellent question. As I told you, desire is generated in the mind. So one to have good desire, one should have a stress-free mind. One should have a stress-free mind. One should have a good hormonal levels. One should have good blood supply. One should have intact somatic autonomic nervous system supply. One should have genital tissue integrity. When all these things are there, yes, that person may be a man or a woman or a girl or a wife or husband or boyfriend can enjoy, can do the sexual intercourse. If any one of these suffers in this cycle, those people will have sexual dysfunctions. So in order to increase the sexual desire, not only the stress-free mind, good hormonal level, good interpersonal relation should be there. That good interpersonal relationship, it goes in a long way to produce hormones in the mind. As a medical student, you and me, when our professor puts a hand on our shoulder, or Venkat, nice, you did nice class today. You did, when you pat us, we get elated. Our dopamine levels are increasing. We feel that we have conquered the world. We feel elated, we will feel happy. We develop affection towards the professor. And we will never forget that professor, and we will be telling whenever our classmates meet, अरे वो प्रोफेसर क्या था यार, मेरे को क्या वो दिन क्या मेरे को पैट किया, ऐसा मेरे को सपोर्ट किया, so we'll be sharing. So also, if the attraction between the wife and husband, that interpersonal relationship is there, it goes in a more positive way in increasing the sexual desire. At the same time, to increase the hormone levels, yes, physical exercise is the only method where non-hormonal, non-drugs, non-medical treatment, physical exercise will increase the hormones. At the same time, good sound sleep. Today, again, in this present world, smartphones have spoiled. Nobody is sleeping 6 to 8 hours sound sleep, including you and me. We may get patient phone calls, but the younger people are getting watching the porno in the cell phones and sleeping somewhere in the 2:30 or 3 o'clock in the early mornings. So disturbed sleep will get disturbed hormonal levels. All hormones are wired in such a way, diurnal rhythm, that will be disturbed because of disturbed sleep. And you rightly pointed out by Datta Saab, today we people are working for America, working for Australia, where everybody is sleeping, this fellow is working. If he is working 360 days in the night shifts, fine, body gets adjusted. If he works in the nights for 2 months, then gets day duty, then gets evening duty. So the diurnal system, the hormonal system will get disturbed in the body. He doesn't know when he is sleeping, he doesn't know what he is eating, when he is eating. Hormones are at hurry, digestive system is at hurry, his thinking process goes array. So such type of lifestyles are also there in the community. And in such a situation, Shama Sultan advises the wife, today is your ovulation day. Don't have sex with your wife, it's a husband. That fellow will have night duty. That month gone. मैं बोले आप सेक्स नहीं किया उसके लिए तो माँ नहीं बने. She will come and hold this fellow. You fellow, that day you are not there. My doctor is scolding me, and you are not making me mother. So lot of tussle. Again, so near yet so part. So such is the situation today. So as a sex therapist, we have to evaluate so many reasons: psychological, interpersonal, socio-cultural, iatrogenic. So in order to bail out non-pharmacologically, sound sleep, sound body, by eating right thing, by doing physical exercise. By eating right thing is, again I'm stressing, today majority of the people who are working class are eating junk foods only. The Zomato, tomato, oh yeah, Swiggy, सब आ रहा है ना. आजकल nobody is cooking in the house. So eating all junk foods, all to make the more attractive, to make more tasty, all saturated fats are used, which are making to get more obese. Aajkal, the India is becoming new Pahalmans. Obesity has become a big problem. That's why diabetic is very high. India is a diabetic capital of the world. We are having many medals. Rape capital, diabetic capital, big second hypertensive capital, second population capital. Like this, we are having many awards. So all these negative awards will make the people to suffer with sexual dysfunctions. That's why eating the right thing, more greeny leafy vegetables, cruciferous vegetables, less fats, more proteins, running, physical exercise, sound sleep, less stress, more positive, enriching interpersonal relationships. This will take away in increasing the sexual desire and enjoying more sexually fulfilling the relationships. Right, Datta Saab?
Yes, sir. Bilkul, sir. Sir, many time actually people are saying that they might watch in some videos or read somewhere, that like eating garlic or having this some pulses like moong or masoor dal especially, they are getting, they have a erotic or this increases the desire. Is this have some scientific, or these all are actually the a wrong or misinformation?
Partly correct, partly not correct. Partly correct in the sense, yes, as you told, this udak dal, menapapu udak dal, that Bengal gram, that is a pro-testosterone, that contains a lot of pro-testosterones. So that's why the vada made of that udak dal, or that laddu made of that udak dal, is kept in the bedroom for first night. This fellow has to eat that to develop testosterone more. The tradition of, in all religions, the tradition of keeping sweets in the bedroom for first night is taking the sweets will release the dopamine in the mind. Feel more elated, more happy. So to give a happy environment there, sweets will be kept there. To release more testosterone, this menapapu, that is udak dal, anything food stuff made of udak dal is kept there. And even this palli, what you call peanuts, they too contains protestosterones. Like these foodstuffs are there, but they will increase when there is a deficient in that particular patient.
Yeah, that is the
Not all patient. तू मैं सब लोग खा लिया तो खाली गैस बढ़ता है, पेट बढ़ता है, उसके बिना कुछ नहीं होता है.
very correctly said, sir.
So when it is deficient, yes, that fellow will feel better by taking this, and he claims that.
And what about
Yes, please.
salt and mirchi powder? नमक मिर्ची कम कर देना इसको, ऐसा they will say. To decrease the sexual desire. नमक मिर्ची
Yes.
कम कर दो.
नमक तो जरूर कम करना है. Namak, salt is a vasoconstrictive. It takes away the blood supply when there is a need. Prolonged usage as a vasoconstrictor, it produces the hypertension, again, which is counterproductive for sex. Leave alone sex, God only knows. That fellow may land up in heart attacks and brain strokes. So namak to jarur kam karna hai. Namak is one, and all males should quit smoking. Is another fundamental culprit. Smoking is also direct vasoconstrictor. I am not advocating alcohol, but alcohol is okay. One can take it because in limited quantities it is a vasodilator. But smoking is a culprit. Salt is a culprit. दोनों भी बंद करना जरूरी है. It will be beneficial.
Sir, some like a few, substance abuses are largely regarded as the aphrodizing agents, which increases this type of libido or desire. Yes. So is there anything like that, or it's like it is also just misinformation? Many people actually, some people drink or take some time of drugs because to increase the desire. Yes. There is a scientific reason for that, or it's just a misnomers?
Again, partly correct, partly not correct. Partly correct. Yes, the food particles which they are claiming as having protestosterones. For a male to get erection, not only the hormone, more intact blood supply, intact nerve supply, and in the penis, nitric oxide release is needed to initiate the erectile process, to initiate the vasodilatation action. When the nitric oxide is released, it will go and hit the cyclic EMP pathway, and vasodilatation will occur, and that will be obstructed by again PDE5 enzyme. That's how the sildenafil came into the picture, where it is going to block the PDE5, that vasodilatation will be maintained for longer time. So all these food particles which we are claiming, some are nitric oxide donors. Say for example, arginine, zinc, multivitamins. All these are nitric oxide donors. So people who are having diabetes, people who are having polypharmacy, using multiple drugs for multiple reasons, there if they take this nitric oxide donors, they feel better. But not a healthy normal fellow like you and me, if we are taking, we won't feel anything. We will say, no, it is humbug by. That fellow feels better because he is deficient, he is feeling better by taking. We are having sufficient, that's why we won't feel anything extra, that's why we are claiming humbug. That's why partly correct, partly not correct.
Very true. Now that when we are talking about the non-pharmacological, now sir, it's a very importantly the pharmacological. Many a time when the people are searching in the internet, even we are getting the questions about all the pharmacological agents who are increasing this desire or libido in male as well as in female. So the first question to you, sir, whether in a case of normal testosterone label, if we are giving the testosterone supplement to either the male or the female, does it has some role to increase the desire, or it just has a IVAS type or placebo effect?
You rightly pointed out, today all our patients are under belief that for every ill there is a pill.
Yeah, that's okay.
They believe that for every ill there is a pill. After taking lot of pains, if you consult your patient for 45 minutes, and if you won't write anything, कि कुछ भी नहीं किया, खाली बाता किया, भिजा दिया.
Exactly the same thing. तो कुछ लिखा ही नहीं, भेज दिया.
500 रुपए खींच लिया, 40 पर 5 मिनट, उसको मेरा टाइम बर्बाद कर दिया. क्या क्या के बता दिया, वो मेरे दिमाग में ही नहीं आया. So everybody is
normal. Also, we need to write multivitamin something for the
they
other.
are under the influence of every ill has a pill. So when such a mood is there, pills will have a role. So when the pill has a role, there should be deficiency to supplement through pills. When the person is eugonadal, when the normal level of hormone is there, if you are giving extra hormones in the form of supplements, this will go on to suppress the hypothalamus. There is a method in the body, hypothalamus releasing the LH, FSH, that will come and hit the testis. Testis will produce testosterone hormone from Leydig cells. FSH will stimulate the this seminiferous tubules, and they start producing spermatozoa. So when the LH is coming from a hypothalamus and hitting the Leydig cells, when you are supplementing more testosterone, the high serum testosterone levels will hit back the hypothalamus. Are already over by, don't send any LH. Are already over or more. So the hypothalamus will stop working, LH will come down. So it is a counterproductive. Instead of doing justice to the patient, we are doing harm to the patient.
Correct.
When there is no LH, no FSH, the seminiferous tubules can't produce spermatozoa. So by giving prolonged supplementation of eugenadal, we are making them infertile also.
Sir, so what is the ideal treatment? Suppose that for in a case of male, where the every hormone seems to be normal, we are rule out any organic causes, then and mostly it's come out to be normal. What's the ideal treatment in these type of cases, in especially to increase the desire in case of male?
As long as desire is concerned, if the hormones are normal, then always in search for interpersonal problems. Search for his health profile. Most of the times you will get the cause here. Either interpersonal problems or life stressors. ऑफिस स्ट्रेस ज्यादा है डॉक्टर साहब, नहीं तो मेरा फाइनेंशियल प्रॉब्लम चल रहा है, मेरा बच्चा लव अफेयर में फंस गया है, वो लड़की वाले लड़ी झगड़ा चल रहा है. Some reason definitely will be there. It is only we the healthcare providers has to dig and find out to bail them out.
Sir, many a time we see, some non like what to say, some multivitamins or something like Japani tail, something Baba ka tail or some
Yes.
Baba ka
Yes.
capsules and everything. And many a time in few places, the newspapers are full of that, and even with that phone number, and people are
Yes.
getting them.
Yes.
And so, is there any effect of this type of things in libido or not? Or these are only the IVAs?
Yeah. Basically, the sex subject is a taboo. Because of the taboo, many people won't come to the right person. They will go to the equally ignorant people like our health RMPs, or go to the open online market where the advertisements will encash them. Advertisement, such a nice goda rata hai usko upar, a goda will attract this fellow. This fellow thinks that he too will become a goda. He'll get attracted to that and start using. When that psychologically, when he gets satisfied, yes, then that fellow go on using. When he is not satisfied, then he will come to you and to me saying that, Doctor साहब 6 महीने से वो दवा ये दवा सब खाया, पैसा बर्बाद हो गया, कुछ भी नहीं हुआ.
कुछ भी नहीं हुआ.
So everything we cannot bluntly, we cannot say it is wrong, and overwhelmingly we cannot say it is right. Lot of ifs and buts are there. Taking the supplement for right person in right dose works. Taking for the wrong person for wrong time, it does wrong only.
And what about those, sir, Ayurvedic products like, sir, ashwagandha, or some are saying, that Silajit and all, there has any effect on libido?
Ashwagandha is a more dopamine donor. It makes the person to feel better. So if that fellow is frustrated, disgusted, stressful, he feels better. Then he thinks, yes, this is working for that fellow. Your Silajit is a nitric oxide donor. If the fellow is having less nitric oxide, that fellow will feel better. If the fellow is having good nitric oxide, good physique, that fellow won't feel better. So the fellow should know whether he is fit to take the drug, whether he is the right candidate to use the drug. So those people who are not right candidates, they will be saying it is unfit, it is a waste drug, barbaad ho gayi. And at the same time, physician also should know which this is the right treatment for this right fellow. Because of our time constraints, because of our parents are pestering, or अरे कुछ ना कुछ लिखो साहब, कुछ नहीं लिखते, खाली 2 गोली लिखे क्या होता है साहब? So we are forced to write some more drugs. In such a way, we will be writing. I am admitting, I am also writing. I know pretty well that's not needed for that fellow, but things compel us. After the consultation, once the wife walks, husband walks first. Immediately, wife says, "अच्छा दवा ताकत का दवा लिखे ना साहब नहीं हमारी जरूरत नहीं है उसको खाली हाइपरटेंशन का दवा बदलना पड़ा दूसरा दवा लिखो दिया ये जल्दी चिट्ठी पे अच्छा दवा लिखो देखो मैं दूध में डाल को देता हूँ so such a mental makeup is there. They are forcing us to write, but in reality that fellow needs a change of antihypertensive. What he is using is affecting. If you change it, his problem is solved. Unless you give some other tablet what the wife needs, the relationship will not be settled. So like this, it's a real challenge for a sexologist to tackle such problems to save the relationship.
Very true, sir. What to you, Dr. Sama?
So actually, patients and common people should come forward with these problems. Actually, as it is a taboo subject and as it is very personal, they think of, but these are having a solution at a correct people. So, sir, whom should they talk about these problems if they are unhappy in their sexual desire? Is our final question, sir. So.
Before addressing this, all governments of all countries should make their citizens aware of their sexuality. To get aware of their sexuality, minimum basic sex education should be there. When minimum basic sex education is there in every citizen of that country, they will come to the right person. At the same time, that is one side of the coin. Other side of the coin, all healthcare providers should have minimum basic knowledge of sexuality. Unfortunately, in India, the medical curriculum is not having sexuality as a subject. From CSEPI, we proposed many times. We used our good officers to present this necessity of this through our member of parliament. The MCI came out saying that we are crushing the medical subject itself. We don't have time, no time to introduce this subject. When the healthcare provider is not up to the mark in understanding the sexuality, when the ordinary citizen of India is not able to aware of what is happening in your body and whom to approach, then all wrong things will happen in the country. This is happening in many countries. Even developed countries are also doing mistakes and having problems. So education level awareness should increase, not only from the doctor side, but also from the citizen side. Then only the right person will reach the right doctor, a right advice will come, and the problem will be solved. Coming back to the question posed to me, who should talk to if they are unhappy about sexual desire? For example, if all doctors are comfortable with this subject, family physician, their family doctor is the right person to approach. Because they are more comfortable with their family physician, they will open up. If they are coming to Apurba, if coming to Sultana, if coming to Neeraj, if coming to Venkatramana, to develop rapport with the patient, it takes 2 to 3 consultations.
Exactly, sir.
So they are more comfortable with their general physician, provided then the physician is having some knowledge about this sexuality. So that at his level, if it is a treatable problem, he can guide them, or it is not beyond his capability, he knows because he is having a basic knowledge about this, he will guide. Are Baba, it's beyond me, go to Neeraj Bhai. It's beyond me, go to Shama Sultana. So he can direct, he can guide them properly. since they are in the dark, they are resorting to cell phone, advertisements, online market, are equally ignorant to his friend tell, "Arey papa, my capsule ka kya acha jabardast tha yaar." So this will also will go and take that capsule. So this type of scenarios will be happening in the community.
Sir, before that, I just because we are talking about how to increase the desire and pharmacological in a case of male. What about in a female? Whatever we have talked about, like we are talking about the food habits, we are talking about some dal, we are talking about the peanuts. This holds true for female also, or
Yes.
she has to take something extra non-pharmacological to increase that.
Non-pharmacological, same thing. Good lifestyle, good food, good sleep, good physical exercise to keep the body fit is sufficient. Pharmacologically, 2 drugs have been recognized by US FDA, but unfortunately, the patient acceptance is very poor. One is flibanserin, other one is Vyleesi. One has to be taken oral form, one has to be taken injectable form. Both are indicated for hypodesire, but the success rate is very poor because of the patient poor acceptance. I can put it in a simple way. Interesting and interested. Underline, interesting and interested partners are sufficient to maintain good desire. It boils down to attraction between the both wife and husband. If it is there, that's more than sufficient to maintain good desire.
Right. Sir, is there one live question is there? Is there any investigation required in case of male as well as in female to in case of reduce the sexual desire?
Only desire aspect is concerned, then the investigation required is hormonal assays, estimating the testosterone free and total. Particularly free testosterone assay is more useful, but unfortunately no lab is doing in India. We are depending more on the testosterone index only. Otherwise, a detailed history taking will solve the issues, for which we healthcare providers should be trained and should have patient enough to, we should create some time. It takes around 45 minutes to 1 hour for each couple. It drains away our energy. At the same time, patient should be cooperative and motivative. Most of the times, the patients are coming to you and to me because of the pressure from the families. 3 साल हो गए, बच्चे नहीं हुआ, जाओ बता ले को वो लोग सेक्सी नहीं कर रहे, बच्चा कैसा होता है? They are least bothered about when you say counseling. ये सब कई को साहब मेरे पिताजी को बेटा चाहिए, बेटा आने का जल्दी बता दो, कुछ रास्ता बताओ. So as long as the couple or the patient who is coming to you is not motivated, the right treatment, right counseling cannot be delivered, though you are prepared to give. Jaisa patient, vaisa doctor. So when the patient is not interested, doctor also will lose interest. चलो बेट तुम्हारा बेटा चाहिए, जाओ टेस्ट ट्यूब सेंटर, फर्टिलिटी सेंटर जाओ. So this is how the things are happening in the community.
And sir, in female, like the label of estrogen, it is necessary. Like in case of male, testosterone is necessary. Female, it is necessary.
Yes, if you want to document, yes, evaluation of estrogen is necessary. Yes, necessary. Many studies are there where less estrogen is linked with the hypo desire.
Right. Sir, in female, like the label of estrogen, it is necessary. Like in case of male, testosterone is necessary. Female, it is necessary.
Yes, if you want to document, evaluation of estrogen is necessary. Yes, necessary. Many studies are there where less estrogen is linked with the hypo desire.
As in case of PCOS and obesity, we means frequently that they have a libido loss.
Yes. Two reasons, one physical reason, two endocrinal reason. Physical reason, in my Hyderabad Hindi, मेरा हिंदी थोड़ा अलग रहता है नॉर्थ इंडिया से. In Hyderabad Hindi, will say, उतनी बड़ी कमर, उतनी छोटी उम्र. The more obese you are, that is less lifespan you have. You cannot do sex, you will get shortness of breath. You cannot walk, you will get shortness of breath. You cannot do anything, you will feel shortness of breath. So physically, you are hindered in doing sexual intercourse. This abdominal fat will convert all your testosterone into estrogen. You will become more feminine rather than masculine. So you develop less libido, less erections, and because of this fat, more atherosclerosis, more inflammation in the body, resulting in less vascularity, less blood supply. At the same time, more the abdominal fat, there is a condition, psychological condition called where the penis will tuck it into the lower abdomen. That fellow will feel that penis has shrunken. That fellow will develop a phobic attachment that my penis is going inside. So all this is a complicated gamut because of the obesity. Why one is becoming obese? Eating all junk foods, no physical exercise, and no proper sleep. So ultimately it boils down to golden age method. 9 बजे सो जाओ, 6 बजे उठो, टाइम को खाओ, घर में पकाए सो खाओ, टाइम को सो जाओ. ये बोलना आसान है, practice में बहुत difficult है.
What difficult. Even we are unable to follow that.
Yes,
What to tell about to the patient?
Yes, that's what I'm telling. That's why every doctor is having some ailment or not. Every 5th doctor is hypertensive.
Yeah, very true, sir.
Every 7th doctor is diabetic.
And
Every 20th doctor is having varicosities. Like this, I have a statistics which I am unable to recollect because I am talking extempo. I am unable to recollect. So doctors are also very bad patients for that matter.
So it was a really, sir, wonderful discussion, and we cover almost, we have a lot of questions in the live as well as in our emails, and we covered almost every questions. The treatment of VD is actually not in for that. The last one which I want to ask, is the fantasy morally correct in case of sexual activity in couple, or what is the role of fantasy in case of sexual desire? What does this mean? This means ki suppose that if there is some loss of desire in the couple, so can they do some fantasy with that, like go somewhere or changing the way of it does has any? Yeah, what's your experience, sir?
More fantasy is for males. That's why male is more spontaneous desire. That fellow imagines his college days and gets desire. That fellow imagines something on wife's body part, he gets desire. That fantasy is more spontaneity in the males. That fantasy is less with the woman. Woman needs more intimacy. She will think always about future. She thinks always about her family because she is the homemaker, home taker. Anthropological wiredness is there. Of late, this present generation of women are developing fantasies because of the availability of the literature, ill-informed literature at the tip of their fingers. Now they are comparing this and they are demanding.
And what I find, sir, in my practice, when a patient come with a low desire or libido, and when I ask them straightforwardly, when you started your sexual activity, and I always find there is a long history of having the sexual activity, probably till the time when they came and to get married and they have such a lot of history of sexual intercourse in the past. Probably they are fed up with that, and they actually have that monotonous and they want something different. Probably this is one of the causes which I find in my practice.
Longer the relationship, boredom is the rule.
Very true, sir.
But we cannot take it in that way. We have to make the relationship to live. That's why we have to bring sparks in the relationship. Because with this principle of longer the relationship, boredom, अरे बाबा normal है तू उधर सो जाओ इधर सो जाओ 20 साल से तू मैं शादी कर लिया ये normal है तो we are spoiling the couple. We have to bring sparkness into the relationship by changing. अरे बाबा you got bored always on the same cot on the wife below. Why don't you change it? नया तरीका, same thing नया तरीका. तो रोज चाय पी रहा है, आज अदरक का चाय पियो, अलग टेस्ट देखो, मजा उठाओ. आज किचन प्लेटफॉर्म में सेक्स कर, मजा उठाओ. आज बाथरूम में दोनों नंगा होके स्नान कर लो, सेक्स कर लो, मजा उठाओ. So change the thing. That's why there is a book called All Success Arts. Intelligent people will do things differently. They don't do things, different things. They do things differently. So same sexual activity, do differently, so that longer the relationship, the spark will be there. Right? Thank you. Thank you.
Thank you so much, sir.
Once again, thanks and salute the sexual committee of Foxy and our Neeraj Saab and his team. Thank you, Anandal.
Nishant, do you have any more questions? I think we cover up mostly all the questions.
So I think I did have a couple of questions, so I don't think.
Sir, Neeraj sir.
Yeah, thank you.
Because we already passed the time. Sir, your interpretation, sir, your last words.
It was a wonderful discussion, and I hope everybody's myths and confusion about the desire will be resolved after this session. So hats off to you, Venkat sir, for putting up in simple,
thank you, sir.
layman's language about everything about desire, and wonderful moderation from our both moderator Apurba and Sama. You are all, as always, wonderful in moderating all the sessions. So thank you both of you too.
Thank you, sir. Thank you.
So should I go for vote of thanks?
Yes.
We already passed the time.
Yes.
Yeah.
Yes.
So after this really an eye opener, I can say it's an eye opener session for the general public as well as for all the medicos in a very tabooed topic. I am tabooed because yes, desire and to have a desire for sex is always seems to be a taboo in our society is really awesome. And I really thankful to none other than but the President Foxy, Dr. Shanta Kumari ma'am, our Secretary General, Dr. Madhuri Patel ma'am, and our Vice President in charge, Dr. Bipin Pandit sir, our chairperson and the man behind all these program, our own Dr. Neeraj Jadhav sir, the chief guest for today, none other than the Padma Shri, Dr. Alka Kriplani ma'am, our guest of honor, our Vice President, Dr. Bashab sir, and last but not the least, our most energetic, most entertaining faculty for today, Venkat Raman sir. Sir, you are such a senior, and really when we are talking to each other, it's like we are talking to our friend. You are so much, simple and down to earth. Thank you so much for always being here and giving your wonderful, to the point lecture and in a very simple language. And definitely my co-moderator, Dr. Sama Sultana, thank you so much for bringing out those questions and moderating so well. Our giantess, our own Dr. Sachin, for being there and for giving us the Nishant to give us organize this webinar. Our partner, the pharma partner giantess, for giving us this platform, and definitely all the viewers who have questioned us, who viewed us, and who have sent their questions in email to participate and give their interest, so their interest in this very unspoken topic. Let's understand desire. So my dear friends, we will definitely bring this type of untold topic in futures today, in future also. So stay tuned. Till then, goodbye. Bye-bye.
Bye-bye.
Thank you so much.
Thank you. Thank you so much, everyone. Once again, thank you so much, Brigid sir. Thank you so much,
Thank
Neeraj
you.
sir. Thank you, Dr.
Thank
Apurva.
you.
Thank you. Thank you.